The purpose of dissecting individual organs is to better evaluate their texture, color, and consistency. You must become familiar with the normal appearance of organs. There are a number of postmortem artifacts, such as bile imbibition and pseudomelanosis caused by autolysis. You will need to learn to distinguish these artifacts from true lesions. Mastery will come from looking at a variety of birds and from correlating gross impressions with histological and laboratory findings. During the detailed organ exam, you will also collect samples for histopathology. It's important to collect representative samples from any lesions observed and to include a piece of surrounding normal-appearing tissue. If no lesions are detected on the organ, collect 1 or 2 representative sections of the organ for microscopic evaluation. Trim samples of parenchymal organs to no more than 0.25 centimeters thick in order to allow the formalin to penetrate the tissue. Samples of tubular organs can be any length as long as their walls are no more than 0.25 centimeters thick. Place the tissues in 10% neutral buffered formalin for fixation. The ratio of formalin to tissue volume in the container should be at least 10:1. After approximately 24 hours, the tissues will be fully fixed. The tissues can then be moved to smaller, tightly sealed containers or bags with just enough formalin to keep them wet. These smaller containers are generally easier to ship or store. The sequence of organ evaluation generally doesn't matter. The exception is the gastrointestinal tract, which is normally saved for last to prevent the contamination of other organs with intestinal content. The heart can be opened and its chambers evaluated. Begin by peeling back the pericardium to expose the heart muscle. Examine the epicardial surface. Next, remove the bottom 1/3 of the apex of the heart. This view will allow the thickness of the walls and septum to be assessed. The right ventricular free wall should be approximately 1/3 to 1/2 the thickness of the intraventricular septum and the left ventricular free wall. In the normal heart, the lumina of the ventricles should be small, and there should be negligible space between the walls of the ventriculi and the septum. In cardiac diseases, such as pulmonary hypertension or congenital defects, this space will be widened. Next, scissors can be used to open the heart chambers and great vessels. Begin by making a cut through the right ventricular free wall. Once opened, the right atrioventricular valve and endocardium can be examined. The septal leaf of the right valve is normally very muscular. Continue the heart exam by opening the pulmonary outflow tract. Examine the lumen of the pulmonary artery, which should be creamy white and smooth. The pulmonary valve is a very thin semilunar structure. Turn the heart over to the left side and make a cut up the left ventricle. Open the chamber and evaluate the left atrioventricular valve, which should be thin and smooth. Insert the scissors up under the left valve and make a cut through the aorta. Examine the lumen of the aorta and the thin leaflets of the aortic valve. Once you've examined the heart, place the entire heart in formalin. If the heart is too small to dissect, you can make a series of small slits along the ventricles and place the entire heart in formalin. After fixation, the heart can be opened and examined in more detail by the pathologist. Open the esophagus for closer inspection. Insert the scissors into the oral opening and cut down the length of the tube. When opening any tubular organ, be careful not to slide the scissors across the mucosa. This will damage the mucosa and make it impossible to evaluate the tissue histologically. The mucosal surface of the esophagus should be smooth and glistening. The cranial portion contains many glands, and the caudal portion has numerous longitudinal folds. The color along the entire length should be pale tan to pink. The presence of proliferative lesions may indicate an infection or a dietary imbalance. Remove a section of esophagus for fixation and place it in formalin. Open the crop and examine its mucosal wall. To see the wall clearly, You can gently wash away food material with some water, but do not scrape the mucosa. Food material should wash away easily, while fibrin and exudate will stick to the mucosa. Look for ulcers and erosions, which appear as red or pale depressions in the mucosa. Collect a piece of crop for histopathology. Next, open the trachea. Insert the scissors between the laryngeal cartilages and cut down the length of the trachea. Open and evaluate the lumen, which should be smooth and pale pink. At the level of the syrinx, the trachea flattens and narrows. Look carefully for any evidence of obstruction or exudate in this narrow airway. Collect a piece of trachea for histopathology and place it in formalin. The healthy lungs of a fresh bird should be pink. However, as the post-mortem interval increases, the lungs will become progressively darker due to congestion. Gently palpate the lungs without crushing them. Normal lungs should feel slightly spongy. Firm areas within the lungs indicate pulmonary disease. Use a sharp blade to make a series of parallel cuts through the tissue. As you cut, be aware of the consistency and texture of the lungs. Focal or regional changes may indicate a lesion. It's normal for a small amount of fluid to ooze from the cut surface of the lungs. Inflammation may result in an abnormal amount of thicker, more opaque fluid. Postmortem congestion can produce dilated vessels, engorged with blood. Select any lesions along with 1 or 2 sites to sample from each lung and place the samples in formalin. Examine the outer surface of the liver. Remember, bile imbibition may cause bile to leak from the gallbladder and stain the surrounding liver yellow or green. Using a blade, make a series of parallel cuts, 1/4 centimeter thick, through the liver tissue. Pay attention to the consistency and texture of the tissue. Focal or regional changes may indicate a lesion. As you make the cuts, it's normal for a small amount of blood to ooze from the liver. Examine the cut surfaces closely. Select any lesions, along with 1 or 2 areas from each lobe, to collect for histopathology and place them in formalin. Open the gallbladder. The gallbladder is usually filled with greenish bile that should have a liquid consistency. The gallbladder wall should be thin and opaque and is usually stained green. A small portion of gallbladder can be collected for histopathology and placed in formalin. Section the spleen and examine its cut surfaces. The spleen may appear slightly granular due to the variations in red and white pulp. Take a section of spleen and place it in formalin. Section and examine all the lobes of the kidneys. The cut surfaces should have a fine lobular pattern. Look for excessive amounts of urates or other abnormalities. Take a section from each kidney, along with any lesions, and place them in formalin.